Good morning, everyone. Thank you for the opportunity to start these sessions on adult hearing screening and why it cannot wait. Well, I think that everybody in this room know very well the impact of hearing loss. That's not only a health issue, but it's a public health issue that affects over 5% of the world population with a profound economic, educational, and social impact. Nothing new there. We also know as well, that was published by the World Health Organization, that 1 in 3 adults over 65, and nearly half of those 75 and over, have hearing loss. But what we cannot ignore is that much earlier than that, we have the age-related hearing loss starting around 40, 50 years of age. And what is interesting is that only 17% of the adults at the age of 50 to 70 actually had a hearing test done in the past. And on average, it is a quite well-known figure as well that on average people take 7 to 10 years to seek help, even when they note that they have a hearing loss. So what is the missing link, right? We know that the hearing loss is the most common sensory impairment globally, but is also, the good news is also a modifiable age-related condition. So knowing these two facts, adult hearing screening is still not implemented, mostly. And what are the barriers to it? I think that there is still a lot of low awareness in different parts of the world. I know that everybody has been working very hard on this, but stigma is still an issue. Coming from Australia, that is quite multinational, let's put it this way. If you talk about different culture, stigma is definitely an issue. Access is an issue. We all agree with that. It takes a lot of resources, what is not widely available for many countries. And is still lack of awareness from professionals in the systematic referral pathway. So how to bridge this gap? The World Health Organization, with the health framework for hearing care, has proposed that hearing screening and intervention is one of the pillars for moving forward in hearing healthcare. So it is mentioned across the whole framework that adult hearing screening, particularly in those with high risk occupational or those at risk of developing hearing loss, should be a standard of care. And actually even propose different, different possibilities that not only audiologists and ENT are should be linked to hearing care, but proposing different alternatives, different pathways for possible different roles in this care. So the recommendations that adult hearing screening should start at the age of 50 and should be a routine as blood pressure or vision check. But now we have been talking about this within hearing for the last 12 months probably, or a little bit more. So it is time to move from awareness. I think that we did it really well, but it's time to move from awareness to action. And I'm really hoping, so my job is to introduce this subject, and I'm really hoping that we can work together to bridge this gap with innovation. We are all a very clever bunch of people. I think that we can come up with something, and I'm sure that the presenters will be presenting things on this area as well, how we can bridge the gap with innovation. Things that are efficient, that is not time-consuming, that really increases their accessibility, and also sustainable, because we cannot leave behind anybody. So I'm really looking forward to the next few presentations where I think that these will be coming to discussion. Thank you.